National Health Mission under the monitoring or assessment mechanism nationwide jaj thakya homoy. Union Ministry of Health and Family Welfare under the 17th Common Review Mission team November 2nd de Zunheboto punchise. Hesker Memorial District Hospital Zunheboto la CMO office te team karne reception program rakhise. Tate Medical Superintendent Dr. S. Zunheboto kotha korea homoy janaise ki quality healthcare service to sob manu pra pabo nimide sarkar bra commitment korea de CRM visit kuriase. टीम रा विजिट करिया होमय डिस्ट्रिक्ट हेल्थ डिपार्टमेंट ऊपर गे खबर नहले भी गाइडेंस तो लुबले कारणे ভাল अपॉर्चुनिटी আছে কইনো কোটসুথোब्रा কইছে प्रोग्राम दे जुनबोतोला डेप्टी कमिश्नर धर्मराज प्रा डिस्ट्रिक्ट एडमिनिस्ट्रेशन ला साइड प्रा हेल्थ डिपार्टमेंट लो सपोर्ट और कोलैबोरेशन निमिदे साथ दे बोले जनाइस सीआरएम टीम लगा बिहाफ ते डॉक्टर सुशील कुमार विमल प्रा ताइखान आया लगा पर्पस जनाइस और हेल्थ केयर सर्विस ते की दिगदार पाया से इतो ऊपर मदद दिबले कारणे आइसे कइनो कइसे टीम रा डिस्ट्रिक्ट ते 3 दिन काने विजिट करिया होमय डिस्ट्रिक्ट ला हेल्थ सेंटर सबते सुपरवाइज करबले আছে
one of the very developed part of the state, but we are lagging behind in many areas, and here especially the healthcare infrastructure. As you have seen, I think this building is the best testimony of or example of the infrastructure here in Zunheboto. When we were working here, we were working very slowly so that the floor doesn't collapse. So this is the reality of our district. And in fact, you have from Dimapur to Zunheboto, you came by Baya Road. I want to remind you that you have traveled the best road in Nagaland. Currently, this is the best road in Nagaland. And when you calculate the kilometers by time, maybe in Delhi or in other parts of the country, you can travel 100 kilometers in just 1 hour. But from here to Kohima, it takes. By then, when the road was not good, we had to travel for maybe 5-6 hours or 6-7 hours to reach Kohima, and then to reach Dimapur, it is a whole day journey. But luckily, the government of India is very thoughtful of us. The government of India is doing so much for us. Every department, they are trying to bring progress and development and also peace to our this part of the country. And so we can see many developments here taking place. And your visit this time, as I mentioned earlier, it's a we are very optimistic. We can see area of light, especially when it comes to the field of healthcare. Here, I want to appeal or urge to the CRM team, to the medical team, that all the schemes, all the missions that the government of India is giving to the people, we want to urge you and request you to make sure that it is implemented in total.
We feel privileged that we got the opportunity to be here in your state, so that we can have the sensitivities or some affections, and we can convey these issues, challenges to the government of India. That's why I am very privileged, so I can make senses in the true sense and can sensitize our seniors. The main purpose of the CRM is not to basically criticize, not to fault finding. We are here for fact finding. We are not the investigators, we are the facilitators. We try to facilitate you, we try to guide you, we try to handhold you. Whatever issues, whatever your barriers, your issues, we'll try to have a sense of them and we'll try to give the solutions. Other purpose is we'll try to focus on what are your priorities in health sector, what are your difficulties, what you face in sense of in terms of budget, in terms of GTPL issues, in terms of HR, in terms of infra, and we'll also highlight what are your good practices. There is always good practices, always whatever you have the issues, but somewhere you are doing some bad practices, and new initiatives also, innovations also. We would like to highlight them and try to implement these new issues or the innovations to other states also. Other aspect of our visit will be equality, equity, and quality. Not only that health system strengthening and all, but we'll see whether these services are providing for vulnerable, whether those vulnerable populations are having access to your health facilities, whether there is the quality services, quality norms are followed or not, whether there is equality in the treatment of people. We know that there are the issues in geographical issues, approach is, accessibility is very poor, affordability is poor, but our system is to serve all, so that affordability is given. Now, these are the general terms when we'll talk about the programs, when we'll talk technical session in the second session. So I would like to assure you, we'll have the true picture. Whatever we see, we'll document it. We'll not criticize, because we know there are the constraints in providing services. Despite of having so much barriers, issues, geographical conditions, road of connectivity, internet connectivity, still we are doing very good in many factors, many parameters like RCH. We are doing. Now the government of India is planning has implemented 12 packages of services. Besides, we understand that we have reached at that level. We can provide the immunization, we can provide the vaccination to the people, we can provide ANC, we are providing communicable diseases. Now we are focusing on NCDs, non-communicable diseases, hypertension, diabetes, cancers, they are very commonly spreading. Now we are focusing on ENT, OPHTA, palliative services. So now our focus is we should implement 6 packages of services also. So we'll assess at what extent you are providing these services at your centers. So we will visit sub-centers, we will visit PSCs, UPSCs, district hospital if any, district hospital, sub-district hospital and district hospital, DCSCs. So this is our overall sense, and other things we'll discuss in the detail